Hi, everyone, and welcome back to the MG Matters series. And this is the third episode. And this is part of the RDCN community, as you know. And here we discuss many subjects that matter in myasthenia gravis. I have with me Professor Anna Rostedt Punga, and we are both delighted to welcome you to a discussion on biomarkers in myasthenia gravis.
Yes, so I'm Professor Anna Rostedt Punga from Uppsala University in Sweden, and I've had the pleasure of working with translational MG research focusing on biomarkers for 23 years now.
It's great to have you today. So let me ask you first, can you enlighten us on what exactly a biomarker is?
Yes, so biomarker is an objective, measurable indicator to diagnose or assess disease severity or evaluate the treatment response. And that it is objective means that it can actually separate the biological processes of disease from that of a healthy state. And one well-known example is blood glucose levels in diabetes as an important marker there.
And by objective, I think we also mean that it's not subject to observer interpretation. It's a number is a number. It cannot be misinterpreted in any way. That's one of the strengths of a biomarker, as opposed to some clinical outcome measures that we use. Now,
Correct.
we talk often about validation of biomarkers. Can you walk me through that?
Sure. So a validated biomarker has undergone rigorous testing and has proven accurate and consistent in measuring the information we want it to measure. So also a validated biomarker should measure the characteristics of a specific disease to separate it again from other diseases and from healthy states.
We talk about surrogate outcomes, and biomarkers are surrogate outcomes. And we do want them also to reflect the clinical aspect of the disease. So that's one more part of the validation, I'm assuming. Would you agree with that?
Yes, that's correct.
So let's talk a little bit about the importance of these biomarkers. Can you walk me through some examples of biomarkers, how they're used and perhaps in other diseases?
Yeah, so I think that one good example is multiple sclerosis, MS, where focal lesions on brain MRI have been developed as the best biomarker for diagnosis and prognosis. Brain MRI as an objective outcome measure for monitoring the disease activity in MS has led to early aggressive treatment for the different forms of MS and also improved disease outcomes due to the link to disease pathophysiology. And such a biomarker in MG would also transform the treatment landscape in MG to better direct the right treatment to the appropriate patients.
Tell me, you've done so much work. You're a real expert in this area. And tell me some biomarker candidates that you think may be viable in the future for the diagnosis or prognosis. Obviously, biomarkers we can use, as you said earlier, not just for diagnosis, but for monitoring and for prognosis. So any candidates that are your favorites?
So I think that the biomarkers that are in development of MG would include the several blood-based targets, such as antibody levels, T and B cell signatures, inflammatory proteins such as cytokines, chemokines, and also microRNAs that drive the autoimmune response. And microRNA is also developed as promising pharmacogenetic biomarkers associated with the treatment response. So we don't have the same as in MS, where we have the brain MRI. It's more difficult for us to visualize non-invasively the neuromuscular junction. So in that case, I think it's more promising for us to go with the blood-based biomarkers.
Yeah, and I think you bring up that very good point. In the MS world, we are so fortunate to have MRI and so many advances in MRI development to make it more and more sensitive as a biomarker. But we are sort of looking at a very tiny area, the neuromuscular junction, and it's hard to use any imaging techniques to look at it. And there are so many neuromuscular junctions. We know in myasthenia gravis, they all don't act the same either. The damage is not the same, so it would be very difficult. What do you see? Now, you sort of mentioned several candidates, and not only candidates, but different subgroups of, of compounds, if you will. What do you think is most likely or most promising as a biomarker in the future?
So I think it's too early to pinpoint the most promising candidate, but if I would have to pick two, I would go with the microRNA 155P in early onset myasthenia in particular, and microRNA 30E5P in predicting both generalization from ocular disease and to predict treatment relapse. So I think that there is most evidence for these at the moment.
Yeah, and I do think that predicting generalization is such an important aspect of this disease, to know exactly. Now we have, time frames. We say we wait for 2 years and 3 years, and if they remain ocular, they're not. But what if at the onset we can predict who's going to become ocular? Then we can say, well, okay, these are the people who we need to treat this way because they're going to become generalized. These are the people we need to treat this way because they remain ocular. So I think that's such an important aspect of it, and that's really exciting. But tell me, when are we going to see this? So is it going to be 1 year, to next month, 2 years, 5 years, 25 years? Am I going to see it in my lifetime?
Yes, I think within 5 years we'll have at least one biomarker which is validated in a large international context. And I think that will be the different types of biomarkers in myasthenia that will be important for different subgroups. They will definitely see it in your lifetime.
Yeah, I think we have a couple of minutes to spare. So I'm going to go back to the microRNAs and sort of explain to us exactly what they do, what they are, and what they do as biomarkers.
Yeah, so they are very interesting small molecules, small non-coding RNA molecules, and they actually bind very specifically to their protein, so to say, at the mRNA level. So they inhibit the production of particular proteins, and very important in regulating different cellular processes in the body. And MIR155P has been particularly focused towards the thymus and also T cells. So that's why it's very attractive in MG, which is a T cell mediated disease.
That's great. Thank you for that wonderful explanation. So what do you think that we as members of the myasthenia gravis community can do to facilitate the development of biomarkers, have blood banked or use patient data? How do you think we can help this development? It's so important, as we've talked about.
Yeah. So I think we need the international collaborative efforts of physicians, researchers, patients, as well as patient communities in this joint effort. And with this comes the potential to have a globally valid biomarker in less time, since validation requires so many samples, as you say, and so many patients, and also clinical information, and MG is a rare disease. So let's work together within the MG community to strive towards these robust MG biomarkers for obtaining the individualized disease control and treatment. That would be the goal, definitely.
Absolutely. And that working together is something that we are so cognizant of, because that's really what brings our patients what they need. So, do you have any other closing remarks?
No, I think that in light of the novel promising therapeutics in MG, it will be even more important to direct the right treatments to the appropriate patients. So that will in turn improve the quality of life in the MG community.
That's exactly it, and we're all moving towards that personalization, especially when we are also moving towards the development of all of these targeted therapies. I do think it's going to be a partnership, right? We have these targeted therapies, but then when we have the biomarkers, both the biomarkers will influence the development of targeted therapies, and the targeted therapies will influence what we use as biomarkers. So I think it's going to be an amazing experience for us as people who take care of patients with myasthenia gravis, and of course for our patients for whom we do all of this. Thank you very much. And thank you all for being here today. And don't forget to join me for the last episode in the MG Matters series, where I will be discussing mental health in myasthenia gravis.